This is validation 6, and I'll be demonstrating the IV medication administration using IV push. Okay, so and the first thing I'm going to do is to review the physician's order for medication administration, IV push, and check the patient's medical record for allergy. Yes, the next thing I'm going to do to grab my MA and do my first check by identifying the correct IV bolus drug, which is a Benadryl 25 milligram administered once via IV push. Okay, so after doing this, I have to check the compatibility between this and the 500 milligram of 0.9 normal saline that should be administered for 4 hours. So if it is not compatible, so what I'm going to do is to, just get my medication, clean the pot here, clamp it up here, flush it with normal saline, and after flushing with normal saline, administer my medication, and flush it again with normal saline, and open up the pot and allow it flow, and I'm done. So, but I'll make sure I clean up the pot in each of the section of the normal saline and the medication. So, but if it is compatible, fine, I go ahead and do the use my mouth to get my medication from the drawer, and I have to compare the check, okay, to compare between the MAR and the medication vial. And this is a Benadryl 25 milligram, administered once via IV push, Okay, after doing the second check, so I have to prepare my medication. So apparently, I'm withdrawing about 1 milliliter. After the calculation, so I have to withdraw 1 milliliter here. Get this ready. Okay, get my normal saline and go into the patient's room. Knock, knock, knock. Hi, Mr. James. My name is John Paul. I'm going to be a nurse today, okay? And I'm here to give you your IV push medication. And could you help me please confirm your name and date of birth? Okay, can I see your armband? Great. And okay, so I'll be doing the third check by letting the patients know the 5 right of medication, the right dosage, name, time, and route of administration. So, and hi, Mr. James. So, I'll be giving you, based on the doctor's order, Benadryl 25 milligram administered once via IV push. Okay, and this is the right time for the medication. Okay, all right. Are you ready for the medication? Oh, great. Okay, so yes, so there are two routes, two ways. So it's either by existing line or I do through IV lock. Okay, by existing line. So the first thing I'm going to do is to check the patency of the IV by checking if there is any infiltration or infection, check if there is any redness or swollen, and the next thing I'm going to do is, yes, I have to flush the IV to make sure there's no blockage. So with my normal saline, clean the pot close to the patient, flush with normal saline. But while flushing with normal saline, I have to clamp, flush with normal saline. After flushing with normal saline, I have to clean, inject, put on my medication. So when I put on my medication, inject my medication, unclamp it, and remove my needle out. So once I remove my needle out, I'll monitor it. I'll monitor the flow, okay, and make sure it's flowing in the accurate proportional rate. Oh, okay, so that's fine. So and that's it. And if I'm to do through IV lock, so the next thing I'm gonna do is to uh, yes, for when I'm done, I have to do the right documentation, the right dosage, the time, the route, and the time of administration. So if it is by IV lock, so what I'm going to do is to get my 2 normal saline, 1 heparin, okay, and with my medication, heparin if the company's policy permits. So come into the patient's room and assess the patency of the IV, check if there's any redness or swelling, check if there's any infection or infiltration. And the next thing I'm going to do is to get the medication, get my IV, my normal saline, clean with my swab, flush with normal saline, clean again with my swab, administer the medication slowly as prescribed, clean with with swab, then flush with normal saline. After flushing with normal saline, yes, and have to assess my patient and make sure he's in order, check for adverse reaction for both the IV, the existing line, and the IV block. So, and go ahead and do my documentation, the right dosage, the right route, and the right time, and the right medication administered to the patient. Do my hand hygiene. Okay, thank you very much. And if you have any question, just call me, okay? All right, there's a call light.